So, know your patient. Just like they said, why would you obtain the blood from the hand when it's very thin, especially in elderly people? The skin turns to like paper. The ethnicity, Caucasian people's skin is a lot thinner than black people's skin. I'm just using an example. So why would you, knowing your job, why would you take the risk in drawing them in the hand? And some people are so petrified, that's the first thing they're going to say, butterfly, butterfly, butterfly. And guess when that does come in handy? Because you're drawn from the hand. And it's a smaller gauge. It's a small, very, very fine, thin needle, which if you're not experienced, it can also be one of the worst things that you use. Mm-hmm. So you, with your knowledge and your experience, and you being a registered nurse, it's gonna be common sense to you that I'm not gonna obtain this blood from that resident's hand. I'm gonna go where there's more meat because it's less of a risk. Guess what? Now this comes into your knowledge of your patient. This patient is anemic. This patient don't drink a lot of fluids. Guess what? It's what the slang word is, bad veins. Now you're gonna have to draw from there because that's the only place that you can get the blood. A lot of people make the mistake of pumping. I see a lot of labs do it, like Quest and LabCorp. You do not pump because it breaks the blood cells up. And I see people do it like right now to this day. They just sit there and they pump and they pump and they pump. You do not do that because it breaks up the blood cells that's going into the tube.
Says it.
So we'll get into that, which is your cheat sheet. So,
Kid as well.
So when you're in
You
the
have
no, no. You can do that before, but not in the process. Because it's not illegal for me to tap on you once I have the tourniquet on you as well. But you should not be holding that stress ball, that's what it really is, in obtaining blood. But you see it happen all the time. But now you know. So now you know, and knowing is what happens. Okay, collecting the correct amount of blood and other fluids. The reason that is very, very vital, just like we're going to go back to urine, which when you're in the facilities and once you girls graduate, your urinalysis, it's a certain amount that they want to obtain. Just like when you said you had to obtain those 24-hour urines, it is a reason. It is a reason why you can get small specimens, small collection of things. Because guess what? It's going on a swab. Which your swab is basically, I'm gonna dumb it down for you, is a Q-tip. So it's just a huge Q-tip. And all I need for you to do for me when I'm working in the lab as a lab tech is to just make sure you absorb enough. So when you see the nurses have, and that's it. So when you see the nurse hand you that little bit of urine and you're like, oh no, that has nothing to do with you. They know. Let them nurses do their job. Which you're gonna be that nurse soon. As soon as you graduate, you're gonna be the person like, okay, now I remember why. Okay, the next one is the reason the correct labeling is in the state of Florida versus New York and Atlanta. The state of Florida, certain specimens cannot be collected unless you are a registered nurse versus LPN. Yes, we know people cheat and you do things. That is at your own risk. But once you are doing this job and you by yourself and you're independent, you are not taking risks because a nurse is not going to vouch for you at all. Why am I going to lose making $80,000 a year over the person that's making 20, 30? I'm not going to risk. So you do the right thing, you don't have to worry about it. Completing and submitting documents needed to lab. So give me an example of the completion because we haven't went over the submitting.
so completion for documents, being that you go out to collect specimen or blood work, which is labs, you want to make sure that the patient name is correct.
Which falls under what? Identifying. That's you. You have to identify first. So that falls under I know that you in that, yep, so it could be at the bedside, on the wall. Once you're in the hospital, hmm guess what? Some people take their bands off. Sometimes family members sleep in the bed when the client went to activities. And guess what? I'm visiting my mom and I'm tired and I'm sleeping in the bed is comfortable. And you just coming in there, hey, I'm here to do blood work. No, hey, you greet yourself, you greet, and then who are, because guess what? We might have the same last name. I might gave you my name, Mary Johnson. So, vital, vital, vital. You think you would have worse issues when it's two residents in the room? You have worse issues when it's a private room. Cause in Florida, you find people with the same exact name. Weird, but in the same facility. They try to put them on different floors. So we're gonna go to the next one. So do yours have reassuring patients? Okay. So why is it not on my computer?
Find patient information to ensure accuracy of tests.
Reassuring patient. But yeah, yours is a patient care.
Monitoring.
So what would you do to reassure a patient? Briefly tell me.
Some patients
Talk to them.
I don't. It is hard and stuff. But you can reassure them and tell them. You can tell them it is not hard.
Exactly. That's just reassuring. But that falls in a big category. Fear of needles, just like I told you. Football players, firefighters, like Garfield is, they drop out. They just being able to answer questions that patients may have. We discussed this before you came. Doctors, anybody that's in the medical field, they have that. They want to know that you know what you know. And me and her had that discussion. You need to know the vein from the artery. You might get a doctor that'll tell you to obtain the blood here, and guess what? It's an artery. And they just want to know how much knowledge you have. And they might be very nice and professional about it and say, guess what? I don't want to get it done today. When you leave that facility, they didn't know what they're doing. I don't want them back. So now the lab have to find somebody to replace you, and this is your facility. When it comes to your coins and your money, you want to keep your facilities. Because if I have to send you because of your attitude, I'm just going to give that to her as far as me giving the cause. Okay? Verifying patient information to ensure accuracy of the tests or procedures. That kind of sounds dumb, like it's repeating the same thing. It's not.
Your mom gone for a walk.
Yep. And some people just looking for lawsuits. That's it. A lot. This is a place that's just they're looking for a lawsuit. So, monitoring patient during procedure to prevent movement or fainting. So you need to know what you will learn in your nursing classes. Is this patient clammy? Are they sweating now? Are they a lot of sweat? Like, so I need to look and I'm watching you. I need to visualize and say, guess what? I'm starting to notice you are getting pale. I'm starting to know that your head is going down. You're not 99, so you're not sleeping. So this is something that you need to, because this means no, you don't need to obtain the blood. Because now, whatever that patient is going through, and it could just be anxiety, you're going to make that condition worse. And yep. And then that's, you stop. You stop. But safety first. You stop. You automatically stop. And that's why you have hand techniques that you use. If you right-handed, your dominant hand and your weaker hand is what takes everything off, because if that patient moves, you want to make sure you are not getting stuck with that needle. Even if they're going down, you might get blood on you, but your main concern is you're not getting stuck with the needle. Once they hit that floor, you know you are applying gauze and whatever. Then you leaving them by putting the protocol of,
Oh, we're probably not supposed to really secure them like that. But if you're in a position where you can make sure that they don't tilt and like everything coming over on you and all that, you can actually.
well, if you're kind of doing your job, it's not gonna happen because you're either sitting upright in the chair, like the old school desk, or they're laying in the bed. And how can you fall out the bed? Now, why are you obtaining blood and your person you're obtaining is way over here? If they're way over there, that's not your problem. If you know you need to go, what you need to do is you need to lift that bed rail up. You might have to let them know I lift the bed rail up. Because you might not have time to push a 300-pound person to the other side of the bed. And you don't really want to do that. You don't want to move them. If they need to be moved to the correct, proper position, you need to notify someone and get staff to do it. Remember, you're from the outside. You're the third party. You don't do none of this. Patient records, medicals, condition, confidential. Even though you see it on, which I haven't told you guys yet, it's the paperwork, the documents of when you obtain, and you're coming in to obtain my blood, it's called a requisition. The short word for it is a rec. So you might have something on there that says that's none of your business. Oh, what do they, I don't know. You really don't, even though you see it, you don't know. You have to, because a CNA might come in, wait a minute, do they have such, you don't know. When you take this job on and this responsibility, it is about confidentiality. I don't care if you're a best friend, I'm not telling, you can offer me $10,000, I'm not about to tell you that's just, it's a big response. What you ladies are doing now, it's a big responsibility. It's a trust responsibility. So, accurate documentation of collection, order tests, and test results. We basically went over that. Test results you're really not going to come in contact with. The lab will. But sometimes you need to know, because I might say, hey, I obtained John Doe blood. Once you learn the tubes and how long the blood can stay, you're saving yourself a trip. Because the blood that you collected, that's why you want to collect a full tube. That avoids you from going back and the lab can use it. Some tubes, like the CMP, serum separator tubes, complete blood count, the purple tubes you were talking about, the blue tubes, automatically, after so many hours, which is 3 hours max, which we will go over that time, they have to be discarded of. Your serum separator tubes that go into the centrifuge, just remember, I'm not going to stay on that topic. The serum separator tubes is the tube that you can get blood from later, which is put in a centrifuge, which we're going to do here once we obtain the blood, and you're going to see where the serum separates. That's why it's called SST. You don't need to remember those 3 initials SSTs right now, but it's going to come back to you. Everything's going to be back in play. Providing accurate documentation to the laboratory to ensure performance ordered by physician. What they mean by that is Dr. Mark ordered a PT-INR. You know that he ordered the PT-INR. You know that it's a blue top tube, but the nurse, so it's a blue top, but we're going to go over what the abbreviations for these things is, but it's a test that you're going to use almost every day. So the reason they're saying this is specifically for, you might get on your requisition sheets, it might say be checked off CBC, which means complete blood count, which is a total different tube, which is purple. You know the lab sent you there for a PT-INR. So what you need to do is you need to contact the lab and say, hey, you guys sent me for a PT-INR, but the requisition page say CBC. You cannot ask them PT/INR. And I'll give you those definitions. You don't need to jot that down now, because that's later on. But listen to what I'm telling you. So, the lab called you to do a PT-INR, which is a blue top tube. The requisition of documents that you go by, they only check CBC. You need to call the lab and let them know, you sent me for PT-INR, this says CBC. always wait and let the lab tell you what to do, because that's usually an add-on from the doctor. I feel that you're anemic. I want to get your hemoglobin levels. So this is an add-on from the doctor. Why obtain that blood and you was there? Then halfway to the hospital when you're dropping it off, you get a call to go back. So that means the nurse that took the first phone call didn't write the PTI. The nurse that took the second phone call, because now the doctor had a history, like how you said you explained at the doctor's office, it's an add-on test. So that's what that means. You went for the PTI. An add-on. That's verifying your documents now. That's why you need to call the lab and say, what you sent me here for is not what's on this document right now. Really not false. It's just different. You just need to know that when you call me, because sometimes the lab can tell you the wrong thing, but you need to verify, because it's two different tools. So if it was a serum test, it wouldn't matter. You can always have the nurse change if she want a BMP, basic metabolic. Do she want a CMP, comprehensive? Did she want a liver function test? It's fine if it was in the red top tube, but you had intentions on a PTINR, which is blue. The chemicals inside of the tube is not going to give you the test. That's used in the tube. Which we're going to go over. Like when you're drawn from the line, which we're going to go over. Your serum don't. Little. Well, that's serum. But the other tubes, liquid, you're going to know, we're going to identify exactly what that's called. Right, which is your basic. That's why I said that big book that you have, don't let it discourage you, because you have your basic tubes, which is really for
a purple, a blue, a red.
Then you have light blue. You have dark purple. You have yellow. You have cultures. You have pink. You have, it's more than just the 5, but that's what you'll be obtaining. But when you're in the hospital, it's so many different colors for so many different reasons. Right. Right. You have speckled, you have plain. So we're going to go over all of that. So now we're into quality improvement methods, which flowcharts is more lab-based. That has nothing to do with you, but that's me working in the lab. And that's information that's going to skip you, that's going to go to the nurse, that the nurse read off, and then it goes to the doctor.
Oh, so it's not really having anything to do with
It showed that is just like a ratio. You're going to have numbers. And the higher these numbers and colors go up, that lets me know in the lab that it's elevated and you probably have a fever. If that bar is down at the bottom, it's what they call being in range. I don't know why the quality of methods is on there. We're going to skip that. But that really should be towards the end of
put a sucker on it.
So I'm going to fold that so we can go back to it. And you guys, fold it. So make sure you fold it in half so when we go back. And then I'll probably put a paper clip on mine. And we're going to skip the next one and go to quality control records should include You see that one that starts with the expiration date?
On.
Oh no, I'm gonna use a paper clip. Thank you.
Include in the following information.
And it should say expiration date. You have it? Okay, so give me an example of expiration dates.
Let's say that
1/11/23.
Okay, that's the date, and then you in the hospital or facility, why would you need to know that? What we just talked about.
just so that we know when the specimen was taken and when it will be no longer viable to be used.
Right, and then the reason that is vital, 24 hours. So why are you having a 24-hour urine submitted if it's been there for 3 days, which is 72 hours? So now it's what? But guess what? Different shift change. And you might come on the shift, and I'm just gonna do the person a favor and collect it. Guess what? That's the voided bottle, and that same voided bottle, which is now an irregular bottle, is submitted. So it's not just thinking that it expired. It's a reason that these things have times on it. It's a reason when I'm hanging the IV, the intravenous. It's a reason why I'm flushing you with so much saline. Those fall into the categories of the time. So they're not as much as expiration date, but that goes back to putting a date on your specimen. Stool, collecting stool, which nobody want to do. Stool times 1, 2, 3, 4. I don't want to collect one.